Hi, my name is Dr. Craig Castanet. I'm going to explain to you the cause of 98% of neck and back pain. This is an example, a model of a low back spine. These are two vertebrae. This is a disc in between, and that's a disc above. There would, of course, be more vertebrae above and more below, with discs in between each vertebra. This is the back, and this is the front of the vertebra. These are intended to be nerves that stick out the side, the little yellow things. They exit the side of the vertebrae in between. Over time, what happens to all of our spines, to varying degrees depending on nutritional statics, genetics, and environmental factors like occupations and physical demands and our weight, things like that, our fitness level. But over time, it's common for these discs, which are very tough, fibrous, elastic structures. And let me go over the anatomy just a moment to explain. There are 12 to 25 layers of tough, fibrous, interwoven tissues here, the outer part of the disc. The inner part's got what we term as a gelatinous component. It acts something like a ball bearing, but it's a softer tissue with a softer consistency. Axial loads or compressive loads on the spine from just being upright, gravity, carrying, lifting, bending, all those sorts of things. Those impose loads on the inner part of the disc, which then pushes out against the outer fibers of the disc and distributes the loads to these outer fibers, which are meant to contain it. These outer fibers, however, over time, as a result of wear and tear and the other factors I cited, nutritional status, genetics, they wear out, they tear. They can permit this inner part to migrate out towards the outer part here, where they may pinch nerve roots, they may bulge or herniate, pinching nerve roots and causing pain that radiates down the legs. Typically the first symptom you'll experience when you have a back problem is back pain itself. As the problem progresses in the disc, you'll begin to get what we term referred pain to your buttock and maybe down the thigh, and then if there's a pinched nerve, it'll migrate. The pain will radiate beyond the knee down into the leg and perhaps the foot. In any case, that's the nature of the changes in the disc that are responsible for 98% of neck and back pain. There are many approaches to the treatment of neck and back pain. Of course, you're familiar with adjustments by chiropractors. You may be familiar with the core strengthening of the trunk muscles by physical therapists, but they really miss the main point. The primary focus needs to be to address the changes that are occurring in the disc that not only are causing present symptoms, which may be milder and only involve back pain or referred pain to the thigh, but to improve the status of the disc so that it doesn't progress in terms of the compressive degenerative changes and eventually give rise to a pinched nerve that radiates further down the leg. Because those sorts of symptoms can be make you miserable and make you disabled, and at some point you've got to address the status of the disc to make somebody better. In fact, consistent with my point that 98% of back and neck pain are caused by changes to the disc, 98% of surgical procedures, when they're done, are effective because they uniformly decompress the spine. These surgical procedures vary in their nature, whether it's a discectomy, spinal stenosis surgery, or fusion, but all three of those procedures are addressing compressive changes in the spine and decompress the spine. They may decompress the vertebrae by jacking them up and fusing them together and removing part of the disc. They may simply remove part of the bone here, lamina, and ligamentous structures that are compressing nerves, or they may just remove part of the disc that decompresses the nerve. But in any case, the common theme is decompression. The disconnect in medicine is that decompression is not a central focus of non-surgical care, and I can tell you that that's irrational. That is a paradox that makes no sense. I have found in my 28 years clinical experience that using a decompressive approach to treatment is the most direct and effective way to get people better from very nasty neck and back problems, including herniated discs, bulging discs, pinched nerves, sciatica, you name it, and chronic neck and back pain. The reason again is that the degenerative changes to the disc result in slow degenerative compression of the disc That puts more pressure on the joint. That over time, including the other associated compressive changes to ligaments and bones, may then make the canal narrow for the nerves and pinch nerves. So the most effective treatment is to use spinal decompression, which is what we use to decompress the spine. And the way that works is we have somebody lie on their back, we secure them to the table slowly and gently separates the vertebrae, it gets more water, oxygen, nutrients into the disc, gets pressure off of the joints, gets pressure off of the nerves, and if you do a series of these treatments, you will partially regenerate the disc and you will make it better. There is no other treatment that will make the disc better. There are other treatments that can provide, for example, an adjustment could transiently change the relationship between the disc and the nerve, may give you relief for a while, but it does not improve the status of the disc. So in the short term, even if in the short term it proves effective, in the long term it hasn't improved your prognosis. It hasn't changed the natural trajectory, the natural history that you're going to experience with your spine in terms of the compressive process that's causing symptoms now and is very likely to progress and cause more symptoms later because you did nothing to improve the status of the disc. All the status of the spine is dependent on the status of the disc. Make the disc status better and you will be rewarded now and in the future with a better prognosis for your spine. Now the core strengthening has a place, but it again does nothing directly to address the cause of your pain. And it's very popular to do core strengthening. Core strengthening strengthens the muscles that surround the spine, and by having stronger muscles you can do a better job at protecting your spine, but that's independent and has nothing to do with the status of your disc. So the best approach to treatment is to improve the status of the disc through spinal decompression, which is what I do and what I found to be the most clinically effective in 28 years, including 18 years in orthopedics and physical therapy and physical medicine, and 4 years in a neurosurgical practice part-time, learning surgical indications and procedures. This is the best means of treatment. It's the most rational, direct, and effective I've found. But getting back to core strengthening for a moment, the value and validity of core strengthening is that it does protect the spine, so that after you decompress it, you'd like to have a strong core so that you can protect your spine as much as possible. And when I say protect, I mean during the course of your day, your spine encounters physical loads, whether it's from standing, walking, sitting, bending, lifting, running, jumping, you name it. They all impose various physical loads on the spine and the disc. So those will typically expedite degenerative changes if you don't have strong spinal muscles, because you don't stabilize the spine, and then the disc is subject to more translatory stresses on it and more movements that are extraneous and insulting to the disc. So a strong core makes sense, but not as a primary means of treatment. If you do the spinal decompression treatment, in my experience, most people will get some relief from the first treatment because of the efficacy. And by most people I mean 60 to 70%. There'll be 30 or 40% of people that won't get relief until you increase the amount of the decompression and decompress this enough. The first time, of course, you're starting with a lesser amount of decompression, and you typically increase it progressively until you've decompressed it enough that the person gets relief and that you've made some significant anatomic and physiologic changes to the disc so that the person stays feeling better, typically for many months to several years. But life is a compressing event. There's no stopping that. There is no solution to that. There's no prevention against life's physical demands. So you will need treatment intermittently with spinal decompression. But that's a better means of treatment for treating spinal problems than using a series of injections or a series of surgeries to address, in the case of injections, either the inflammation that arises as a result of this mechanical problem, or in a series, in a case of surgery, multiple means of relatively risky procedures to decompress the spine. So that's my explanation for neck and back pain. If we can help you, my name is Dr. Castanet. I'm in Decatur, Georgia. The phone number is 770-908-0740, and the website is backstrong.net. Thanks very much. Bye-bye.